Okay, let me just address one or two more questions before we go into some of the other stuff. I'm trying to make this as interactive as possible because that's very important. So, please, I don't mind you asking questions. You ask questions. I'll be more than happy to address your questions, inshallah. Okay, right. That's fine. Now, let's just put things into context. Okay, now we're talking about life support. Okay, what is life support? We talk about life support all the time. What is life support exactly? So life support refers to techniques and procedures to artificially replace the function of vital organs. That's the purpose of life support. The objective is to buy time for patients so that they can be treated for the underlying cause or are able to recover on their own. That is the purpose of life support. Okay? So life support is a technique or a procedure we use to buy time. It's not a cure. Life support is not a cure. The Islamic rulings make reference to cure or relief of symptomatology. Here, life support clearly is just to buy time so you can intervene, either because you need to buy time for the person to recover within themselves, or you need to buy time because you need to intervene with certain other medical treatments and intervention. That is the purpose of life support. The issue in hand arises when people think that life support is actually a treatment or a cure. That is not the purpose of life support. There are different types of life support. Even people use life support and they think of, one particular apparatus. There is what we call mechanical ventilation, which is assists or replaces a person's breathing through the use of a machine called a ventilator. There is what we call cardiopulmonary resuscitation, which provides blood and oxygen to body tissues, especially the brain, when a person's heart or breathing stop. So when you resuscitate somebody, what you're doing there in essence is you're giving them life support. Okay? So that's done in a way where you're practically, an individual is actually giving that life support to this individual until emergency care has arrived, and then they can take over and actually treat this individual. Then we have what we call artificial nutrition and hydration, which is considered as life support in certain individuals. So this is essential for life when someone cannot eat or drink. And it's administered through a tube, such as a pen tube. It's inserted into the stomach, intestine, or a vein, such as a central line or a venous cannula. Then you have dialysis, which is a life support. So substitutes for lost kidney function. So for example, people who are on dialysis, that is a kind of a life support for them, because if you take them off the dialysis, they will die. Give them time, they will die. Their kidneys will become much more impaired and they will die. So this is a form of life support. It's buying time. But dialysis does not treat the condition in the sense that it doesn't cure them. It's just a life support. And that's the important thing to understand when we talk about the issues of life support. Okay, we got another question which I will answer, inshallah. So you're an ITU registrar. So Yasser Mustafa. Okay, you're an ITU registrar. We often judge a patient to be not a good candidate for ITU. Example, 90-year-old with dementia who has multiple comorbidities and limited physical reserve, i.e. poor quality of life, presents with septic shock, meaning that they have an infection of their blood and hence they are very unwell. Even though there is a chance that a central line and vasopressors may technically buy enough time for antibiotics to reverse the condition, we say not for ITU and for ward-based care. What's the Islamic stance on this? Now, there's a couple of principles I can give you because each one of those individuals will be different. So the principles are that the first thing you need to recognize, that you need to determine by them going into ITU, is there a sense of certainty that this will improve their health? If there is an element of certainty that this form of approach in ITU, which is much more intensive care, will improve their health, then it becomes mandatory from an Islamic perspective to do that. Okay, remember the certainty. If there's ghalabatul dhann, so it's not a level of certainty, and that patient turns to you and says, I don't want to. I want to just be left alone. I don't want intensive treatment. And they've done this in an advanced directive. Clearly, they'll be unconscious. Or the family are clearly stating this, and they know this patient really well. However, if the best good practice is that you must take this individual into the intensive care, then on the basis of good practice, which becomes a medical legal issue, you should do that because it becomes a duty upon you to do that. That's a separate. So this becomes, again, more a medical, ethical, legal sort of issue, okay, in terms of what's considered as good practice. There are al-'adat al-muhkama, which is a principle that is used in Islam, which says that custom is what is considered as the hukm. So what that means is the custom is considered as the ruling. So in medical field, what we look at is good practice. What is the good practice for you to do? If you have not done something within good practice, the ada of physicians at that time, then you are negligent and Islamically you are sinful. Okay, so that's the general gist of that response. Okay, inshallah. So let's continue.